Well, hey everybody, it's Sandy, and welcome back to my channel dedicated to helping you advocate for your own health, one topic at a time. So, guys, today I just want to do a video. It's just a little kind of a free flowing of ideas here about, where I am on the continuum of COVID mitigation. And I think most of you know where I am. I'm pretty risk adverse when it comes to COVID-19, and I'm finding myself more and more in the minority. I've been sort of a minority all the way along, but all the more so now. And the reason that I bring this up now and that I want to have a discussion about it now on camera is because I've noticed that there are a couple of things that are really difficult for me to take, but there are other things that have given me a great deal of peace of mind. And there's a lot of good news for those of us who are increasingly shocked at how just the ability of the general public to pretty much ignore the pandemic at this point, given the fact that it's raging, and where that puts everybody else. And there's some very good news there, which is that you really do have the ability to protect yourself quite well now. But I'm going to get to that in just a moment. So, the genesis of this was in the Facebook group. More and more, I'm reading discussions in the Facebook group, and I put my 2 cents in, and where people are just, we're always shocked when it turns out the president has COVID, the Queen of England has COVID. We're always like shocked at these public figures that I agree should probably be setting a better example. And yet, I don't know why we're shocked, because really largely society has moved on and most people are really just done with mitigation. And on the one hand, it doesn't make a whole lot of sense, right? Because there have been times when we had infection rates that were far lower than what we have now, even, and since we've had vaccines, where there was much more mitigation in place as a matter of rule. And now we have infections raging by anybody's estimation. The infection rate is very high and probably very undercounted. And yet we've abandoned mitigation, and it's really, at least we've abandoned rules of mitigation. I know the CDC has some recommendations about it, but I think it's largely ignored. Sorry. And the onus has been put on the individual if you want to protect yourself. It's sort of everyone for himself. Yeah, so, I have a hard time with that as well. Just like some of the people who are chatting in the Facebook group. And let me give that a plug really quick while I'm at it. Sandy's DIY Health Advocacy does have a Facebook page, and you can head over there and ask to join the group. It's a nice interactive discussion. So it's sort of like, the people who would be viewing my channel. But it's more interactive in that way. So yeah, head over there if you haven't checked it out already. But, I'm as frustrated as the people there are. Okay, when I read that, the president has COVID or Dr. Fauci, our chief officer has COVID, and prior to that was in a room with 1,200 people and removed his mask. I don't know what to think. And I get very frustrated with a couple of things. One is when people say, well, the vaccines, were designed to prevent severe disease and death. And they're doing that, and case closed. Well, that's not really true, is it? The vaccines were designed to prohibit the disease itself, contracting the disease. They were designed to cut down on that. I'm not blaming anybody who made these wonderful vaccines. I'm very pro-vaccine, and if you haven't been vaccinated, I think you should go out and get vaccinated. If I hadn't been vaccinated, but I've been boosted twice now, I definitely would be vaccinated. But we did move the goalposts a little bit, guys, and I think we just have to be intellectually honest about that. Do I think it's great that we're still preventing hospitalizations and deaths because of the vaccines that we've got? Yeah, I do. But honestly, for most of us, hospitalization and death wasn't, the likely outcome unless you're elderly, have severe disease and things like that. There's a huge number of people out there, like myself included, where I'm more worried about things like long COVID. Death and severe disease are something to be avoided at all costs, and I'm grateful that the vaccines are still covering all of us in that way. But that's really the tip of the iceberg with this disease. There's this whole long COVID and all these heart issues and diabetes and all kinds of sequelae that are sort of hiding under the waterline, which, all under the umbrella of long COVID, that is still being studied. And the study of that is in its infancy. And that's pretty much being ignored. And that really does bother me. And I think the reason that's being ignored is because largely the information we're getting and what we're hearing is most of the talking is coming from politicians who have like 2-year, 4-year cycles. And why worry about something that's, 10 or 15 years down the road, and let everybody look back at it when after I've won an election and been out of office and, whatever. And I'm not talking about any one particular party. I don't like politics on my channel, but I think it's because COVID has become so political that we're really ignoring what is the real issue, which is the morbidity at this point. It's not the mortality now anymore. You have a choice about being vaccinated. It's really the morbidity. And it bothers me a lot that we're pretty much ignoring that. I think that's what's going to be affecting the younger people. Healthier people have robust immune systems that can kind of turn around and work against them. And I am hoping that that conversation is beginning to shift a little bit, but we're going to need a lot more study in that area, and that's going to take a while. And until then, I think that we all have to operate on the assumption that, anytime we're taking a risk of getting COVID, even though it's going to be quick and mild, that doesn't seem to be the correlate in terms of how likely it is to become long COVID. Now, I know that's true with other viruses. Lots of other viruses have long syndromes and things like that, but there's just so much we don't know, and some of it just seems so awful when it comes to COVID. So that's one of the things that really bothers me. The other thing is this narrative, well, we're all going to get this. Yeah, that's true. That's probably true, right? Most of us are going to get this at some point. We're all going to get this at some point. My thinking is the later the better. I mean, first of all, we're always, developing, we're always getting more information. We're hopefully developing more therapeutics, better vaccines. There's all kinds of things on the horizon as a result of this. So that's a little bit like saying, well, we're all going to die someday, so that means I'm going to go lie down on the highway. I just think that that's kind of, if you're decided that for whatever reason, the calculus for you is that you're going to just completely give up mitigation, far be it for me to, I don't think that's a wise choice, but, go ahead. It's your life, and there's, as long as you're not breaking any laws. And, but the notion that we're all going to get this someday is not really a good way to, it's not a good bolster for that decision. So that's the second thing. On a good note, let me flip to this. And this should really give people a great deal of comfort. And I tried to make a point of this in one of the discussions recently that came up in the Facebook page. The onus has been flipped onto the individual. And that's going to mean that there are some things I'm just not going to be doing. And, some of my relationships have suffered a bit from this. I'm pretty risk adverse when it comes to this disease. But we have the N95s. Now, I've reviewed lots of N95s on my channel. In fact, I have a playlist with all the different reviews I've done of N95s. I'm going to link that here. I'm also going to put it down below in the description box. But, early on in the pandemic, we didn't even have, surgical masks, okay, much less N95s, because that was all having to be funneled to healthcare workers. Everybody remember that? And the emergency use authorization for like fabric masks. And oh my goodness, don't get me started with the bandanas. But, now we can all get N95s. And by the way, an N95, even though it means that in order to get the NIOSH approval to be called an N95, it has to filter at least 95% of small particles. Most of them, are in excess of 98, 99%. Now I hear people say, I don't like the N95. It makes me feel this. It makes me feel claustrophobic, whatever it is. But, again, this is sort of an individual choice at this point. And the way I look at it is that N95 is sort of allows you to live a lot more of your life than you would otherwise. You can do almost anything wearing an N95. I mean, an N95 is what people are wearing who work in the hospitals around COVID patients. I've been going to occupational therapy with recovery from my thumb. I go in there now, and you're supposed to wear a mask in there, and there's people in the physical therapy side of the room that are like huffing and puffing on treadmills, and the mask is down below the nose or below the chin. That's even better. And I was so scared at first, people are wearing bandanas. It's just, oh God. But I've worn an N95 in there every time I've gone in there. And, I've been pretty close to these people. I don't think the distance, that whole 6 feet thing is ridiculous. When it's aerosols, it's like 20 something feet is really, the pertinent space. We had somebody else write in the Sandy's DIY Health Advocacy Facebook group's page discussion. Somebody who's an active participant in that discussion is a dentist. And Dr. Graham Dursley, and thank you, by the way, for writing it. He wrote that, he hadn't gotten COVID at this point yet. I hope you still haven't. And here he is working all day long not only on patients who are unmasked, but he's in their mouths, right? And some of the stuff they do produces aerosols. He's like just a couple feet, maybe at the most, from people's open airways and generating aerosols. And he's wearing an N95 and he hasn't contracted the disease. So that N95 is very protective. And, you can look at it now like, you have a choice about it. You have a choice about that. Where do you want to live? Now, there's still some things I'm not doing. Like, I'm not going indoors to a restaurant. I would have to take off my mask to do that. And I'm perfectly happy dining outdoors. I don't know what it would take for me to get into like a movie theater, like a crowded movie theater. My guess is with an N95, it would probably be safe, but I wouldn't enjoy it. But I'm at least down to that part of it where I can do the risk benefit analysis for myself and just ask myself, like, is my enjoyment going to be a factor because my anxiety about this is going to be a problem? And, I can, knowing intellectually that I am very safe with an N95 on, I can decide now that I'm going to make myself do certain things and make myself get comfortable with certain situations. So like the one I've just stated, I've had to make myself get comfortable in a setting where I was going to occupational therapy, which is the same room as physical therapy, which is kind of like being in a gym. People are on the recumbent bikes, people are on the treadmills, people are, lifting some weights, and lots of these people have, if anybody who has a mask on, it's a substandard mask that's leaking anyway, right? So I don't know why I care about the ones that don't have the mask on. But, that's really allowed me to get comfortable, to have a little hindsight to look at and say, look what I've done and who I've been around, wearing my N95 and totally fine, right? Look at the dentist who's been kind enough to talk to us on the Facebook group page, who said, for the last 2 years, more than 2 years, been wearing an N95 like this far away from patients' mouths, even back before we knew as much as we know about mitigation, and hasn't gotten it. So I think there's some very, very good news here. And if the onus is going to be put on the individual, then at least the individual has the opportunity to mitigate the risk as really as much as possible. Why somebody wouldn't do that, I don't know. Okay, don't even get me started there. I don't know why somebody wouldn't wear an N95 in an indoor crowded situation. I don't know why you wouldn't just go ahead and avoid COVID. Sometimes you say that to people and then the response you get is, I can't put my life on hold anymore. It's like, I didn't say anything about putting your life on hold. I was just talking about wearing a mask, So I don't know. I wore masks, like I said, in the operating room for like over 30 years, every single day, all day. So maybe not N95s, but it's sort of the same principle, So I'm going to continue doing that, and I'm going to continue pushing myself, like I have been already, to get into more and more social situations, wearing my N95 and get more hindsight and comfort with it. So yeah, that's my answer. Do I still think it makes no sense, for the president of the United States or the Queen of England or somebody to get COVID? Yeah, I don't think that makes good sense. I do think that they should be wearing respirators. Certainly, our chief officer, Dr. Fauci. I think it would be a better message to the public to be doing that, and instead of just saying, well, the vaccines were there to prevent serious disease and severe disease and death. I do think we're doing the public a disservice ignoring the potential for long COVID. I think that's going to have more far-reaching consequences, unfortunately. And I think that kicking that can down the road or not talking about it is going to make it worse. So I'm trying to do my part, by helping raise awareness about that. But let me know what you guys think. Let me know what you're doing, and let me know what's working for you, what's not working for you, if you've learned any lessons from this, and what you might do or any tips you might have to get more comfortable going forward. So until next time, be well. Bye-bye.